Welcome to the Holistic Plastic Surgery Show, where we dive deep into the hottest trends in health, beauty, and cosmetic treatments. I'm Dr. Anthony Youn, America's holistic plastic surgeon. Well, this is part 3 of a 3-part series of solutions to flatten your tummy. Part 1, we tackled bloating. So if you're interested in part 1, check out about a month ago, we did a episode with Summer Bach on how to banish your belly bloat. Well, 2 weeks ago, we talked about how to flatten your tummy after having multiple children or after losing a lot of weight. And I talked with Dr. Remus Repta about the various types of tummy tucks that can be done to get rid of that post multiple pregnancy and weight loss tummy. Well, today we're going to focus on fat. And this is going to be hopefully a very straightforward episode where I'm going to start by explaining how you get rid of the fat of your tummy as well as the different types of fat. And then we're going to end with a very interesting interview with a doctor who is an expert at abdominal etching. And abdominal etching is basically a way that you can liposuction a six-pack. So kind of interesting, and we'll get to that very shortly. But I'd like to start by talking about the different types of belly fat. Now, the first type of belly fat that you need to know about is visceral or deep fat. And this is fat that is inside the abdominal cavity. And this is fat that's around your inner organs, like your intestines. Now, typically this type of fat we inherit as a fat distribution pattern. And the classic example of this type of visceral fat is a gentleman with a pot belly. Now, if you're watching the video podcast today, you can see a picture of a guy with a pot belly. And this is fat that if you feel the fat, if you feel the tummy, typically that tummy feels very firm, okay? Because the tummy is round, not because it's been stretched out by pregnancies or by a lot of excess weight in the past, but it sticks out because of the amount of volume of fat on the inside is pushing the tummy out to make it larger. This is also fat, once again, that we typically inherit from our parents. And so a lot of guys who have, let's say, a pot belly find that their dad has one too. Okay, and contrary to popular opinion, it's not just due to drinking too much beer. You can get belly fat even if you don't drink beer. But this is just a very common fat distribution pattern that you see in men, and you also see it in some women. Now, unfortunately, with this type of fat, the pot belly type of visceral fat, there's nothing we can do as plastic surgeons to get rid of it. You have to get rid of it yourself with diet and exercise. So I wish there was something that we could do to suck that fat out or melt it away, but there just isn't. And so if you're the type of person that unfortunately has this visceral fat, if you've got a tummy that sticks out, it's fairly round, and it feels real firm, then it's a possibility that it's visceral fat and a plastic surgeon can't help you a whole lot. You got to go with diet and exercise there. Well, what about subcutaneous fat? This is the other layer that we deposit fat. And subcutaneous fat is fat that is below the skin and above the muscle. And you can see on this picture, if you're watching the video podcast, this is fat that you can pinch, okay? You can pinch the fat between your fingers. It feels soft because it's above the muscle and it's just below the skin. And this is fat that you can get rid of surgically and even non-surgically. So what's the easiest way to get rid of fat? Well, one of the things that we have in my office that has been working very nicely is a treatment called Sculpture. Sculpture is a laser made by a company called Cynosure that we can use to melt fat away without any invasiveness at all. So basically what it is it is a laser that you attach onto the surface of the skin. The laser bypasses the surface of the skin and goes into the fatty layer and destroys some of those fat cells. And we can see up to a 24% reduction in the thickness of fat after as little as a 25-minute treatment. So not so bad if it's 25 minutes and you can get rid of up to 24% of the thickness of your fat. And we do find that after multiple treatments, you get a nicer and nicer result. Now, the great thing about Sculpture is that it is non-surgical. There's no needles, there's no surgery. There is a little bit of discomfort because you're going to feel some of the heating up of that fat, but it basically shows it working, and people usually tolerate it very, very well. I've had it myself and tolerated it just fine. Now, if you're watching the video podcast, you can see a before and after of Sculpture, and here's another one that you can see on the video podcast as well. Well, what if the sculpture isn't enough? So sculpture and cool sculpting, another one's called True Sculpt, these non-surgical fat reducing modalities are definitely proven to work. But you have to keep in mind the results that you get from it are usually fairly subtle. Now, I did talk about how to get rid of unwanted fat on one of the mini podcasts in the past. So I would encourage you, if you really are considering a non-surgical fat reduction treatment, take a peek at one of these old Holistic Plastic Surgery Show podcasts. I'll try to look that up for you while we're talking. And that can really go into detail of all of the different types of procedures that we do for it. Okay, so what about if that's not enough? Okay, if you've got excess fat of your tummy and it's not enough necessarily just to do the sculpture, if you've got more than just a small amount, then you need to consider something more invasive. And the more invasive is liposuction. Now, liposuction itself is pretty straightforward. Basically, it's a several-step process where we make a small incision near the area that we're going to suction out. We inject an anesthetic solution into the area, and then utilizing, you've seen it probably on TV, a long metal rod, hollow metal rod, we stick that up to a suction, and we can literally suck the fat out. Now, this is a surgical procedure. Some people will do it under a local anesthetic if it's a small area. But most people find that if they want lipo, it's not just a small area they want lipo in a bunch of areas. And so typically, this is a procedure that I perform under a general anesthetic, and it is something that usually people tolerate very well, but it is true surgery. Okay, so if you see our video podcast, you can see a before and after picture of somebody who has had this procedure done. Here's another before and after if you're watching the video podcast. So the great thing with lipo is you can get some very impressive results, but it is surgery. And liposuction can take up as little as an hour in the operating room if you're just doing a small area to several hours if you're doing a large areas. And we'll also want you to know that the FDA does not recommend having liposuction done as an outpatient if you're having more than about 5 liters removed. 5 liters is the equivalent of probably approximately 10 to 12 pounds of fat. Okay, and so if you're looking at liposuction to help you lose weight, it's a very difficult way for you to lose up to 10 pounds or so. It really is best not to be used that way, but it's best to take care of areas that are kind of stubborn areas of fat that you can't get rid of. Well, what about some of these other types of liposuction? You may have heard about ultrasonic liposuction, like the Vaser. This is basically when you have liposuction to melt fat first before it is removed, and you melt it using an ultrasonic handpiece. This is something that if you've had liposuction before and there's scar tissue there, then I think ultrasonic may help to get rid of the fat more expeditiously and maybe a little less traumatically. But other than that, I don't find that it has a whole lot of use anymore. I did use the Vaser for several years early in my practice, but did not continue using it. I think I stopped using it just over maybe about 12 years ago. Laser-assisted liposuction is also something that was very popular several years ago. The big one is called Smart Lipo. And the idea behind laser-assisted liposuction is that we pass a little laser probe underneath the skin to try to heat the skin up before the fat is removed. And the idea is that by heating that skin up, you can hopefully get some skin tightening. The issue with the laser-assisted lipo is it's typically best used for small areas. And so if you want a lipo, let's say underneath the chin, then doing laser lipo may help a little bit with that skin tightening. But the majority of plastic surgeons would tell you that looking at large areas, doing laser liposuction to that probably isn't all that helpful. And it does add a lot of cost and time to your surgery. Water-assisted liposuction, called the body jet, is also out there. That was popular a few years ago. I don't hear a whole lot about it anymore, and I'm not sure that it really gives a whole lot of benefit to the patient having it done. So it's not something I have much experience with, but once again, was something that I heard a good amount about a few years ago, and really it seems to have died down. Now, you may have heard of PAL, or power-assisted liposuction. This is a final type of liposuction out there. This is basically where the cannula, the liposuction cannula, vibrates very quickly, allowing the surgeon to remove fat with less effort. It really doesn't necessarily give a different result to the patient. It's more to help lessen the strain on the surgeon. So this is something that some surgeons use basically to make it easier for them. Other surgeons say, actually, I get a nice workout doing lipo, so I don't really need the power-assisted lipo. And so other than maybe making the surgery last a little shorter period of time, I don't know that the PAL does a whole lot for you as a patient. So if you are interested in learning more about these non-surgical solutions to fat reduction, then check out our mini episode. Now this was back from July 29th, How to Lose Fat Without Surgery. This is our mini episode number 16. So we went over all the different types of non-surgical fat reduction treatments available. All right, well, that is basically the deal with how to get rid of fat utilizing liposuction, as well as all the different types of liposuction out there. What we're going to do next is we're going to shift gears a little bit, and we're going to talk about how we can etch a six-pack, how you can use liposuction to get a six-pack. And I'm going to introduce Dr. George Bitar. He's going to join me in just a few minutes. He is a fellowship-trained, board-certified plastic surgeon. He's performed over 10,000 cosmetic procedures. He is the founder and medical director of the Bitar Cosmetic Surgery Institute in Fairfax and Manassas, Virginia. He was voted a top plastic surgeon by the Washingtonian Magazine, U.S. News and World Report, and Castle Connolly. And he's recently been named as one of the most influential Lebanese personalities in the world. He is also a clinical assistant professor at the George Washington University. So I'd like to welcome Dr. George Bitar to the Holistic Plastic Surgery Show, where we're going to talk about how you can use liposuction to etch a six-pack. Thank you so much for coming on the show, George.
Hi, how are you doing, Tony? Good to see you.
Good. So the big subject of this episode and last episode of the podcast is all about flattening the tummy. And
Sure.
You have got a technique that the vast majority of plastic surgeons don't do. It's a very advanced technique, and it really is the only way to get a six-pack without necessarily getting it all yourself. So
That's
it's
correct.
called abdominal etching. A lot of doctors have given it other types of names. Can you explain to me your technique, how it works, and what you can achieve with patients?
Sure, Tony. Well, thanks, first of all, for having me with you, joining you here today. And we have a lot of patients who go to the gym, who eat right, who diet, but who are frustrated because they don't have the six-pack abdomen that they want or that they feel that they've worked so hard for. And so that's where cosmetic surgery comes in. I've been doing it for 15 years now. We have hundreds of very, very happy patients here in the States and all over the world who come specifically for this. And it's basically high-definition abdominal etching. And it's essentially using advanced liposuction to achieve that result without having any implants placed, because some people think we do put implants. There are no implants, but we do high-definition liposuction to the abdominal muscles, which we'll get into a little bit now, and sometimes inject fat to make those muscles more prominent if somebody is lean and does not have enough muscle volume or healthy muscles in their mid-abdominal section.
Mm-hmm. So on the first segment of this podcast, I talked about liposuction and about how liposuction typically isn't used to create a six-pack, but it's used to flatten the tummy, to get rid of stubborn areas of fat. You're using basically then advanced liposuction techniques as a way to mold the fat then basically to create that six-pack.
True. As I explain to my patients, to put it in simple terms, the abdomen has three layers: the skin, the fat, and the muscle. Mm-hmm. So basically what we're doing is if somebody has good skin tone and good muscle tone, but they have that intervening fat that you cannot get rid of despite the fact that you're dieting and you're exercising, that's where a six-pack abdominal etching comes in place. So by removing the fat in a very specific way that accentuates and enhances the muscle tone and the muscle structure of the mid-abdomen.
Mm-hmm. And how does the abdomen feel afterwards? Because normally you think of a six-pack and you think of rock-hard abs, basically. Does that fat feel kind of similar to that? How do you explain it to your patients?
So basically, by removing the extra fat and chiseling the midsection of the abdomen, the rectus abdominis muscles, around the tendinous inscriptions, around the border, on the lateral borders, as well as recently we've been doing more definition on the oblique muscles, on the serrator anterior muscles, it creates that look of a hard abdomen. So yes, it does look and feel hard, provided that they do have good muscles underneath, because this is an operation that removes the fat. It's not going to grow muscle for you. If we do inject fat and do fat grafting to those muscles, it is going to give them more volume. But the thing that I've seen, Tony, over the years is it makes those patients who do this operation much more motivated to keep the results and even enhance them in the gym. So in a way, it's sort of it makes them more motivated to work out better, to eat better, to lead a healthier lifestyle, which is what cosmetic surgery is about, to enhance your life.
So who is a good candidate for this procedure?
The good candidate for this operation is somebody who, first of all, is within their normal weight. So you don't want to be too skinny or overweight. Somebody who works out, who eats properly, who's a non-smoker, who leads a healthy lifestyle, has good skin tone, not loose skin. So somebody who's lost a lot of weight and has extra skin is probably not a good candidate for this operation. Somebody has good muscle tone. So a woman who's had multiple pregnancies and childbirth where her abdominal muscles have been stretched is probably not a good candidate. But somebody who has good muscle tone, good skin tone, and some extra fat, because let's face it, if somebody has no fat, has amazing skin tone, amazing muscle tone, they don't need this operation in the first place. They already have six-pack abs. So somebody who has the basics underneath just kind of comes to me to remove that extra fat and makes those muscles more accentuated. That would be a perfect candidate.
And we've been
anywhere from age 18 to age 65. I mean, my oldest patient, I think, was in his late 60s. So,
wow.
I feel as long as you're healthy and you do the right things, I think you could be a very good candidate at almost any adult age.
And your results are speaking for themselves. As we're talking, if you're watching the video podcast today, you're seeing these incredible before and afters. And you may look at the after and say, well, this is a real six-pack, right? And it's a real six-pack that Dr. Bitar has helped create for them. But as you can see, if you look at the before pictures, these aren't patients, just like you said, that have a lot of loose skin, that are significantly overweight, but it's people who are really kind of taking that last final step to create the look that they want. Can you walk us through how the surgery works? What type of anesthetic? Is it a general? Can you do it under a local? How long the surgery works, or how long the surgery takes, and the recovery associated with it?
Sure, it's pretty straightforward. So first of all, obviously, you have to pick the right candidate. As we mentioned, a few of those elements. We do a consult in the office, and then when we deem the patient appropriate, they get medical clearance from their doctor and a few labs to make sure that they are healthy. Then when we get to the operating room, we have two choices for the patients. We do under general anesthesia at the hospital. I operate at Innova Fairfax Hospital, which is one of the top 50 hospitals in the country. Or we do it in our own center at the Bitar Cosmetic Surgery Institute in Northern Virginia, where we are well equipped in the operating room to do it under slight sedation with tumescent solution. So if somebody chooses to be awake during the surgery, they can. If they choose to be asleep during the surgery, we give them that option. Anesthesia aside, what we do is we inject tumescent solution in the abdomen to numb up the abdomen and make it less painful and decrease the amount of bleeding, because liposuction can cause some bleeding. And then when the abdomen is ready, what I do is liposuction the whole abdomen, so get rid of about 80 to 90% of the fat that I would normally do in a traditional liposuction. The thing that sets the abdominal etching apart is after we remove 80 to 90% of the fat, then go and do the etching, essentially remove 100% of the fat along the midline of the abdomen, along the lateral borders of the rectus abdominis muscles. Now I'm getting a little technical, along the tendinous inscriptions, so the horizontal lines, to give that actual six-pack abs. And then sometimes we go and feather it a little bit on the sides, do some liposuction on the oblique muscles, on the serratus muscles, even on the pec muscles. So it depends on what a person is looking for. Some special situations, I've had male models, for example, who don't want a six-pack ab, they want a three-pack ab. So I just do the longitudinal lines. I don't do any horizontal lines because they want that sleek look, but they don't want an overly athletic look. So, that's something between me and the patient, and we decided. The incisions are very minimal incisions. They're hidden either in the belly button or at the bottom of the tummy. And once we're done the surgery, here's the cool part, is that we put like a tic-tac-toe dressing. So put cotton dressings to basically push that skin down on the muscle so that as the person is healing, for the swelling and the scar tissue not to sort of get in the way of the excellent results that otherwise they're going to get. So by putting that tic-tac-toe cotton dressing and then taping it to the abdomen for a week or 2 weeks, it ensures that they will heal with that six-pack abdominal etching. So essentially, then we put them in an abdominal garment. I tell my patients 1 week of no work, eat your proteins, drink your fluids, take your vitamins, be healthy afterwards, stay off of the cigarette. But most of the patients that we operate on are not smokers, so that's not a big issue to begin with. And then after a month, I tell them, as the swelling subsides, you can go back to the gym, you can go back to your exercise. And after 6 weeks, I pretty much tell them you can do anything you want. So it's a gradual healing process. But because of the swelling and the inflammation, and because we do aggressive liposuction on the muscles can get inflamed. So they really need to have that period to relax afterwards. Mm-hmm. We have patients who fly in for the surgery. So we tell them, stay 1 week in town here so I can take care of you. And then after they leave, we can do Skype consults. We can do FaceTime, emails to basically follow up with our patients.
Now, are there certain things that patients need to be aware of if they're considering this? Pitfalls maybe if they have the wrong doctor do it. Have you seen patients who've come in who've had this surgery botched that you've had to try to repair?
Absolutely. I mean, I think like any cosmetic surgery, I think doing it is easy. Doing it right sometimes can be very difficult.
Isn't that true?
I do a lot of revisions on people who've had the liposuction by somebody who's sort of like trying it for the first time, and they come and look like they have like squares on their tummy where the anatomy was not respected, and it just looks odd. It doesn't look like they went to the gym and worked out. They just look like there's something weird going on in their tummy. So that goes along also with somebody who's doing this operation who's not familiar with the anatomy. As plastic surgeons, Tony, we go through great length to learn the anatomy. When you do tummy tucks, when you do liposuction, when you do a lot of abdominal surgeries, you are very familiar with the layers of the abdomen and where to do the liposuction and where to not do liposuction, and where the inscriptions of the tendons come. So, I caution patients to research the doctor that they want to have this done, because anybody can do liposuction on them, but not everybody's going to give them a natural look like they've been going to the gym and developing those muscles. And like I said, if somebody is lean, we end up injecting some fat in the muscles to enhance the appearance. So in addition to the liposuction that we do, we also we use laser to tighten the skin. So that's part of the liposuction. The lasering tightens the skin, it melts the fat. And then if we need to inject fat to, structure it well, those are refined and advanced techniques that somebody who's just trying it out, who has not gotten the proper training, may not give the patients the best results or, the appropriate follow-up that they need.
Now, traditionally, women make up 90% of plastic surgery patients, but this is one of those surgeries that has traditionally skewed a lot more male than a lot of other procedures. What do you see in your practice as far as men versus women having this procedure done? I'm assuming there's a much higher percentage of men than 10% of the
correct.
Procedures you do, right?
That's absolutely correct. I think this is the one exception to my usual practice where I think the tables are turned. I think we probably do about 90% men, 10% women.
Oh, really?
And I would do, in my practice, it's about 80% women, 20% men. So in this case, it's almost the reverse. I have done quite a bit of six-pack abs on women, usually either athletes or models, fitness models, women who basically work out in the gym, who are amateur, models, but they want to have that six-pack ab and enhance what they've already done on their own. So, we've done it. I've combined it sometimes with breast augmentations or Brazilian butt lifts, where you take the fat from the abdomen, you etch the abdomen, and then the fat that you remove, you can inject it elsewhere to kind of like reshape the whole midsection of a woman who wants that done. So we do it, but yeah, definitely it's more popular among men.
So one question I have for you is regarding long-term results. And, you can create, if you've got somebody who's 30, they've got good tight skin, the person's male, so they're never going to have children, so that skin's never going to be stretched out if they don't gain a lot of weight. What do you tell patients as far as long term? If they say, hey doctor, how am I, I'm 30 right now, it looks perfect, how's it going to look when I'm 60? Is that a concern of yours? How long have you followed up patients? I know, like me, you've been in practice, I think a few years longer than I have, right?
Yeah, we trained in Beverly Hills together a couple of years apart. I've been in practice for 15 years now. So I have had a 15-year follow-up on my six-pack abdomen patients, and I'm very pleasantly surprised because it almost becomes a self-fulfilling prophecy. These people who have paid their money, have worked out and have created the six-pack ab, and now that they see the amazing transformation, they almost want to hang on to it. They don't want to let it go. So they end up eating well, they end up going to the gym more, they end up, following their, coming back to their follow-ups religiously over a year. I have one gentleman who sends me pictures from all over the world. He's so happy with his results that he takes pictures as he travels and sends me his pictures.
Of his six-pack everywhere he goes?
Absolutely. It's kind of funny.
That's great.
But so these results are, permanent as long as you don't gain weight. I've had, a few patients, maybe 2 or 3 that I can remember over the years who have gained weight, but that's, less than 1%. So I think as long as you mentioned, because men, don't, they're not getting pregnant, obviously. Typically, by the time they're an adult, and if they have not had some traumatic experience in their life that allows them to gain a huge amount of weight, is if they're still within 10 to 20 pounds of the weight that I did their six-pack abs on, they're okay. I've had occasionally men coming back to me, 6 years later, 8 years later, to do a touch-up, really, because the inscriptions where I've done the midlines and the horizontal lines hold in place beautifully. If along the areas where the muscle now has a little bit of extra fat, we can go back and liposuction it a little bit. So, we do touch-ups in cosmetic surgery on multiple procedures. That's no different. We can do it. But of all the operations that we do, I've been pleasantly surprised that this is one of those operations that does create long-term value for the patient, and the amount of investment that they put into it, whether it's with time, energy, money, and recovery, I think is well spent.
Mm-hmm. Well, his name is Dr. George Bitar. He has a practice called Bitar Institute. He's a board-certified plastic surgeon, good friend of mine. Once again, like Dr. Bitar mentioned, we both trained out in Beverly Hills. His website is bitarinstitute.com. That's B-I-T-A-R Institute, all one word, .com. He's active on Snapchat at Bitar Beauty. Instagram is Bitar Institute. And their Facebook page is Bitar Cosmetic Surgery. So he has got one of the premier plastic surgery practices in the Washington, D.C. area. And if you are looking for six-pack abs and all that working out and the dieting and stuff can't quite get you there, then he is the guy to see. Thank you so much for coming on the show today, George.
Thank you very much, Tony. Great to see you as always.
I appreciate it. So once again, his website is bitarinstitute.com. Thank you so much for watching. I'm Dr. Anthony Youn, America's holistic plastic surgeon. This is the Holistic Plastic Surgery Show. We'll see you next time. Do you want to look 10 years younger without having surgery? Well, my best-selling book, The Age Fix, will tell you how. I spent the past 17 years learning the secrets to turning back the clock, and have written all the best of these secrets in this book. This includes the Age Fix diet, simple changes to what you eat that can make a huge difference in your appearance. I'll share with you a simple skincare routine to keep aging and wrinkles at bay. And I'll share with you the best secrets to treat every single beauty and aging problem there is, from age spots to wrinkles, saggy skin to bad breath, saddlebags to hair loss. And almost all of these can be effectively treated without surgery. So are you ready to turn back the clock and kick Father Time's backside? If so, check out The Age Fix. Now, if you purchase it on my website, dryoun.com, you'll get over $10 off the cover price, free shipping, and you'll receive several free gifts, including a bonus chapter that you can only get by purchasing the book there. Thank you for making The Age Fix such a huge success.